All right, so welcome to our July sales call where we are going to get a little bit of help for social media posting and where to post, when to post, how we gather that information from Shania. So I am excited to learn this stuff, Shania. So take it away.
Awesome. I'm excited too. Welcome, everybody. So today we're going to go over kind of what it looks like to post content, not just to, everyone and like random things and not spin your wheels for hours, but really content is not that hard if you use what you have. So that's really what we're going to talk about today. I'm going to break it down into very tangible pieces so that when you guys leave this either podcast or watching it on YouTube, you'll feel a little bit more clear on what you should be posting based on your niche. So the biggest takeaway is you don't have to be a content creator. You just have to point the phone at what you're already doing. So the beauty of us as physical therapists, we literally have content every single day that we can be posting, whether it's our commute to our patients' homes, in raw treatment. And I'll give you guys specific examples that will be beneficial for specific content to post later in the discussion today. But whatever you are already doing, that can be your B-roll. So A-roll, think about it as like you're talking to the camera. B-roll is kind of like the doing, the showing, if you will. And that's really what's performing well on Instagram. Not saying talking heads aren't either, because both go hand in hand, but we're going to go over kind of what it looks like and delve into a specific B-roll post that went viral on our page at Concierge Orthopedics and kind of show you kind of how that works. So where do we start? So the biggest thing is, like I said, you don't just want to post to the abyss. You want to try to make content that's for a specific person. So if I were creating content for Kelly, I would want to, touch on some pain points that she has or interests. Kelly has 4 kids. I would try to curate my post that's going to be beneficial for her. So maybe one of her, kid athletes or something like that. Specifically today, I'm going to go over a plantar fasciitis example. And the specific person that I want to reference is someone who is looking up plantar fasciitis pain at 11 p.m. on their phone. They're Googling, like, what do I do for plantar fasciitis pain? And hopefully they will come across our post with strategy and get clarity. So who in the call today already just kind of just posts whatever or spends a ton of time spinning their wheels, or maybe just doesn't post at all because they don't know what to post?
I just post like whoever I recorded that day.
Okay. Love
Like
it.
there's zero strategy.
Okay. Evie?
I kind of post what is in our monthly themes.
Mm-hmm.
So some strategy for her.
Yeah, that's
Yeah,
some
because you
strategy,
guys
exactly.
provide it.
Mm-hmm.
Yeah.
Yeah, but if I said go post, would you have something that you want to post today or have like a specific idea without like looking at that?
Um, Yesterday I did 3 myths on cash-based PT.
That's
So it was
awesome.
kind of a little on the theme, but not really. I just didn't want to be
Yeah.
repetitive with it.
Yeah. No, that's really good. And I think like that's not to a specific person, that's just a specific idea, which can maybe speak to a specific person, but this is how we're going to break it down. So these are all great. Okay, so we're going to find that specific person. Today we're talking about this plantar fasciitis individual who's looking on Google at 11 p.m. because their heel hurts. So they're probably Googling things like, okay, what do I do for plantar fasciitis pain? Maybe even looking for reels on Instagram, and we'll get into that more today. Just post it. This is like a big takeaway that I want you guys to really see from today's conversation. So if you were to take a video, Kelly, of a patient, let's even back up. Let's say one of your kids were to take a video of a patient, because I know this has happened with the force plates, and it was shaky. Would you be apprehensive to post that?
Would I be what to post it?
Apprehensive.
Apprehensive? Yeah, I
Mm-hmm.
probably, if it was bad quality video, I wouldn't do it.
Okay. So the big thing is like just post it. The slightly shaky reel, the not perfect, everything is what's really performing well. Like people want to see the raw. They want to see you like, in the grit of like real life. And if it's a slightly shaky video, like just post it. And I think that's where we get like hung up, is that we want it to be super curated, super edited, that is great for certain content like ads or certain things. Like I'm not saying it's not good to do that, but like the raw and real are what people want to see. They want to see you in the grit doing the thing, even if it's a rep that a patient did and maybe it's not a perfect rep because you're cueing them. Like post that. show the before, the cue, and then the after. So I just really want to highlight that too, because I think we make it so much harder than it needs to be. And I'm guilty too. I'm, no expert here as well, but I think just post it. Okay. Does that make sense?
Mm-hmm.
Mm-hmm.
Perfect. Okay. Make them want to watch. So when you are on social media, right? As a person, what is drawing you? And this is to everyone, so feel free to fire away. What is drawing you to want to watch? Like if you're just doom scrolling, if you will, or searching for reels in your feed, what makes you want to watch?
I mean, if
For
it's
me, it would be
relatable. Oh, sorry. Go ahead, Evie.
okay. For me, it would be something that, yeah, is relatable or I'm interested in.
Okay. Kelly?
Yeah, like maybe something that I love the ones where it's like the funny observations that like we all have, but we've never said it out loud. Like I like those. Um, or if I'm
Okay.
just like, what are they doing? What are they fixing to do? You know what I
I
mean?
love
Like
it.
when
Yep.
you really can't figure it out, and like you're like,
Mm-hmm.
let me watch this and see what they're talking about.
Yep. So
But
relatable and humor, like reeling you in. So maybe they reel you in with some humor and then they give you the relatability later too. So those can go hand in hand. I love it. I think like a big thing for us that I'm going to pull is one of our posts where we posted physical therapists be like, no one would ever pay cash for my services. So that's a big one in the cash pay space that we see a lot because the value of what we do is not always seen in our profession, not only from an external standpoint, but also from other clinicians. So I'm going to kind of delve into what that specific post looks like. Whatever. Okay. I'm just going into this. Would ever pay cash for my services. So what services? I'm reeled in. I want to know what specifically, what is this? What is this service? So like when you have a catchy tagline with the text on screen for a B-roll, that's going to reel them in. And then the other part that I'll get into too, and then the second half of it is, and it's unethical to charge that much for PT. So like, I'm like, how much are they charging, right? Like it's relatable for us because we are cash pay clinicians. So I want to read more. So that is a big thing too, is kind of stopping the scroll with words and getting them to buy in, if you will, to that hook that you're putting on screen. So how do we find these hooks and how do we know if they are good? So the next point is going to be trial reels. So you can test these and we're going to go over a specific example. I'm going to share my screen and show you how to find good text on screen, but you can utilize AI. You can see what's performing well, what objections are showing up specific to cash pay in common threads on Reddit, different posts and things like that. So you can prompt AI, but there's also tools in Instagram that we can see in terms of what's going to make it better for our hook and what's going to perform well. So say I come up with this text, no one would ever pay cash for my services. It's unethical to charge that much for PT. Okay. I'm like, I don't know if it's going to perform super well. This is where trials come in. So how many of you use trial reels currently?
I'm using them, but I don't know that I'm using them correctly. So like when I post a reel about once a week on our
Mm-hmm.
corporate page, and then I'll do reels on my personal practice. And I'll
Mm-hmm.
do the same thing. I'll save it as a draft. I'll post one as a trial and I'll post one regular because I
Okay.
do feel like every time I do a trial reel, I get new followers because it's just
Mm-hmm.
showing to like strangers, right?
Mm-hmm.
Not
Mm-hmm.
followers. But I
Yep.
don't have a lot of strategy. I'm not doing like anything different. Like I'm not doing iterations or like a A/B testing, nothing.
Mm-hmm. Okay, that's really good. So yeah, A/B testing is awesome. So think of trial reels like a free ad. So it's going to a cold audience. These are all non-followers. So if you're skeptical or uncertain or you don't know if the hook is going to perform well, trial reels is a great place to test it because it's going to non-followers and that's going to be a lot harder to get traction than if you were to post it to a warm audience like your own page. So a lot of times, personally, what I'll do is post in trials, kind of see how it goes, retweak the hook. So you can even change. So the hook, we haven't gotten into it yet, but we've gotten into the text part of the hook. but there's also, so not just the verbiage, but also the visual. So a big thing when you hook people is you want to have the video be captivating, not like the beginning. So say, Kelly, you were doing like cupping. You had a good video the other day of cupping someone's lateral quad. You would want to be like mid-action in that video, which I didn't break it down piece by piece. I just happened to see it, of when that cupping is taking place. If Kelly set all of her cups on the table, got the gun out, put the cups on the table, I'm not really like super interested, but she's like moving the leg, like I'm in. So we also have to remember that when you're posting for a hook content and making them want to watch, you want to make sure that your video, whether it's a talking head, so you're talking to the screen, that A roll or B roll, is mid. It's not like, hey guys, welcome, like I'm gone. So like, okay, plantar fasciitis pain cleared in 3 moves. Like get into the grit of what you want to say, because that's going to reel people in. So it's very important. Does that make sense?
Mm-hmm.
Okay.
Mm-hmm.
So say we trial, quote unquote, trial this as a hook and it performs well. What would be, Kelly, I feel like you know the answer, so I don't want you to answer. What would be a good numeric value to kind of see like, okay, did this reel perform well? So say I have 1,000 followers on Instagram and I'm looking to see like, did this reel perform well?
I only know
No.
because you just told me.
Yeah. So, okay. So we'll get into the logistics. So it's not that easy. If you get views on a reel, I could get 1 million views on this reel and have 1,000 followers, and it may mean nothing. What we're looking at are metrics. So how many people liked it? How many times was it shared? Who commented? Was there a call to action where we sent them something? For us, we send them, they comment more. We send them 5 cash pay tips. Okay. What curated their engagement, and what specifically did we get out of that post? So if we got 1 million views and no followers, that's really not that good. Okay. There's a lot of different metrics to look at. However, if we got 1 million views, obviously our content's interesting, but if no one followed, there probably wasn't enough value to say, hey, I want to follow your page. So some things that we can do, and we'll get into this a little bit more because I'm going to show you guys a specific example, is your call to action can actually help people want to follow your page. So there's an example, like if you follow, you'll add more free PT advice to your feed. That will save you thousands on copays. I'm in. I'm like, I want to save thousands on copays. So thinking about like, if we just did more and maybe they commented more, but they didn't come follow us, maybe we need to curate that call to action to be a little more enticing so that they actually want to follow our page. And I'm not going to get in too deep to kind of overwhelm everybody, but the big takeaway that I want you to think about is if you are afraid to post, just post it in trials and just post it. Because if you're not posting it, you're essentially like leaving money on the table for referrals, leaving, essentially posts that are probably going to do amazing, even though they may be a little more raw than you would like, just in your B-roll on your phone. And that's not being useful for anybody. And you're not going to be able to help as many people as you want. So like Kelly said, she will make a draft. Always make a draft. So when you go to post, you will do it in Instagram like normal, and I'll show you guys a little bit later. You will save it as a draft. You will duplicate that draft multiple times, and you will post one in trials and leave the rest in drafts so that if that performs well, and when it does, you can go back to that draft and repost it. You never want to share directly from the trial to your feed because that kills the Instagram algorithm. You would want to post the trial, leave your little friend the trial reel there, let them sit, and then make a new post, so hitting the plus button on Instagram, directly to your feed. That's going to allow you to get the best traction and the best kind of engagement in terms of the Instagram algorithm. Does that make sense?
Yes. And then
Yes.
are you doing iterations of it? Are you doing multiple trial reels to test them out?
So you can. So so I specifically said if one performed well. So if this one tanked and it got, 5 views, okay, where did it tank? So you can delve into the insights too. And that's where I'm going to show you guys a specific example to see like what is happening. Like, are they watching greater than 50% of the video, or are they dropping off? Did they even look at the hook? And we'll get into the insights too. But again, for time's sake, today, I would test it, see how it performs. I would also encourage you, if it doesn't perform well, you can look and see where they dropped off. but you can tweak a couple different things. So I don't want to overwhelm everybody, but you could clip the video and keep the hook. You could ditch the hook or the text on screen, if you will, and change the B-roll too, and just kind of see where it performs well. But we'll delve into that specifically. That's a great question, Kelly. But yeah, you could do this for hours and hours on end. But I think the biggest thing to note, if you posted this specific cash pay reel in trials and you posted it on your feed, 9 times out of 10, it's going to perform well on your feed because it's to a warm audience. But what are the goals of the post? That's where I would say, like, how many times do you want to iterate it? If you didn't gain followers and traction, I would say tweak it more and kind of play with it. If it went off, I would share it right away, meaning post it directly. But it's not to say that if it didn't perform well in trials, it's not going to perform well on your page. This is just a spot where you can iterate and tweak as you see fit based on the Instagram insights. And we'll go into that after I go over what to post next. Does that make sense?
And define viral, because people throw that around.
Yep. So we're going to actually get into that right after. So you're teeing me up. Yep. So, okay. So we're going to go on what to post. So B-roll. So like I said, the raw footage, people want to see you showing like real life scenarios. So for us, cash pay PT, what are we going to post? So you're not creating content, you're capturing it. So what would be some specific B-roll rather than just the patient that you saw, Kelly? Do you have some specific ideas of content that we could post?
I'm going to turn my camera around right now and like have B-roll of this video. I had one the other day where I was just cleaning. I've done some unloading my car.
Yep.
Yeah, I'm like literally going to turn it around like we're on a sales call right now. And
I love that.
And have it on
there.
So
cleaning up is great. And that's the one that I'm going to show you guys. I was literally cleaning my table and it went viral on our page. And viral, like Kelly was curious, is considered to be 4 times your follower count. So when we go, and I'm going to show you guys this example. So if we have 1,000 followers on our Instagram page and a video gets 4,000 views, that is considered viral. Okay. So just when you're looking at things that are performing well or researching, you want to see, are they getting the 4 times the view count? And that's just what has been shown in terms of the algorithm to perform well outside of just rudimentary things. So if someone has 1 million followers and their video gets 2 million views, is that viral?
No, it's not even that good for them.
Exactly. Okay. So manual, cupping, dry needling, those are great things to post. So when you're performing treatment, what would you have to do before getting the B-roll?
You mean like setting up the camera?
Yep. Another thing. One more thing.
Getting the patient's approval? I don't know.
Amen. Yep. So make sure they fill out that social media release consent form in Jane. And then if their preference is faceless, just get the joint or the body region that you're treating. And they're usually super cool with that. Okay. So cool cueing. So cueing an exercise, and then that goes with the before and after. So if they do a squat, you cue them, it looks better. That'd be a great thing to post and kind of, show the transformation, if you will. One idea and one reel. And then I was going to say whiteboard, because Kelly does these a lot, where she will literally draw it up because you're reeled into so that would be like a visual hook. Like, what is she drawing? Why is there a spine on the board? Assessment. So performing an evaluation, showing the goniometer, showing the range, and maybe a before and after of that would be good. And then the cleaning up. Kelly, you went over that, but just like cleaning up your table, cleaning up the area. People love cleaning videos. It's just like super interesting. Like it just visually captivates people. So those are some big things. But does this make sense of like just getting content out there as a whole? Yes. Okay. All right. I'm going to take a second. I want to ask, what questions do you guys have for me thus far?
So the trial reel, there's an option to post to your page.
Do not do that.
Don't do that.
No.
So if the trial reel does well, then because you've made a draft, then you're going to post it just as the other plus sign.
Yes.
Yeah.
You would just do, I'm going to request to share too. I'm going to share my screen and show you guys. You would just do a new organic post, because when you post from the feed, it just doesn't perform well because it's kind of already been intertwined. Again, not an expert on this, but intertwined in the algorithm. So you're going to get a better performance if you do not do that.
Okay.
Okay. So can you guys see my screen okay?
Mm-hmm.
All right. So we're going to look at the concierge feed here real quick. I want to show you our page. One second. Okay, so we're going to look at some videos that have done really well. So this video is the one that I want to show you guys specifically. So this video on our page performed ordinarily well. And it was the text on screen. It was, boring B-roll, if you will, based on just me cleaning. People love that. So you can see 80, I'm just going into the insights. So I clicked on the insights and we're kind of looking at where the views and traction came from. So it's got 21,000 views and we have just over 1,000 followers on our page, which is pretty remarkable. 97% of the views were non-followers. I just clicked on this individual video. So when you guys go look, it also got 170 likes. So obviously people resonated with it. Actually, yeah, 163. The video says 170. Comments, 2 people commented. It got 28 saves and 19 shares. So shares are gold. They, for some reason, just based on kind of where Instagram is headed, when someone sends a reel to someone, it drives the post up and it increases your visibility. And the algorithm loves that. So it's not just likes anymore, but it's like, how is this content relatable to someone else? That's so much so that they want to share it with their friend. So this one did decent. I feel like it could have been better in terms of the shares, but overall, viral post. So cool to see in terms of kind of our page.
I also feel like it has a lot to do with, not overproduced. Like there was a while where I was just putting into CapCut, like everything into CapCut. And I feel like now it's just like just the video with the text, which is interesting.
Yeah, I agree. So this specific reel went absolutely viral on our trials. And I'm not going to go into it, but Kelly, you had over 60,000 views in trials.
I got some hot comments from there. They weren't always kind, which was funny.
That's the problem of going viral right there. But this is still viral. So it got over 7,000 views on our page. You can see the non-follower reach was pretty solid. Followers. So this isn't a trial reel, right? We're looking at these statistics from our organic page, which is really cool. And this content really resonated with a lot of non-followers. Same with that other one. So it got 12 shares, 7 saves, 11 comments. And this was a direct call to action of more. So they wanted our cash pay tips, which is great.
We got a ton. Yeah, we got a ton. So you could have made that better I could have made that better by saying comment more and follow for more tip.
Yeah.
Whatever, however you
like, I don't want to say like one thing is better than the other, but like follow for more tips is just like generic. So you could literally prompt Claude, and I'm not telling you guys exactly like you must post this script. You could prompt Claude and be like, hey, I want people to follow my page. I want it to be organic. So like if you follow, you'll add, this is the one I came up. If you follow, you'll add more free PT advice to your feed that will save you thousands in copays. Like, what is she doing? I want to know what's going on in this video. Like Kelly could totally rework this video and explain like what she's doing and why physical therapy could help in maybe a few sessions from cash pay or something like that. So yeah. And
I actually did do a patient version of that and a provider version.
I love it. And do you know how the patient one performed?
I don't know. Let's see. But keep going and then I'll.
So yeah, no, this is great. So does this all make sense? I know it's a lot of things, but does this make sense to everyone?
Yes, it does. Quick question for you though. What if literally every single one of your patients says no to social media? So then the only content you can really do is of yourself.
I would recruit people. So I know you've been good. Your brother, Amelia, use some of that content of dry needling him. Recruit your boyfriend, recruit family, recruit people because no one knows who they are. I would and that's what we've done too for like even like corporate photos and stuff. Like it's not real patients that we get to come in. It's just friends and family. And it is good because you can take as much time as you want to. And I feel like I have that barrier sometimes too. Kelly is very fortunate having a lot of like young athletes who are in the gym who don't really care. Their parents don't care. But sometimes like when you get to a little bit older clientele, like they just want to come for PT. They don't want to be, I totally get that, Amelia. I run into that too. So I will like literally recruit friends, family,
Or just
or
the
do,
body part, like
yeah, the
just
body
the,
region, like cupping. Like people are usually comfortable if I just do their back versus showing their face. Does
Okay.
that make sense?
Yeah.
Okay. I want to get into how to search for hot topics.
yeah.
So this is the last little piece. So, okay. So I'm just going to show you guys, because my original example was plantar fasciitis. I want to show you, if I just search for plantar fasciitis, like what comes up and what I would look for if I were seeing this. So this one's really good. I've already looked at this. I did a little legwork, but I don't know if it's good, so I'm going to click on it. So what we can do, and this is going to be a little bit different than what you'll see on the mobile, because you can see a lot more on mobile. But what I would do is this will show how many, so this was liked by, all these people. So how many followers this person has. Okay. So she has 175,000 followers. So if I look
Oh,
at,
so that's not as good as I thought it was going to be, huh?
yeah, so if I look at like any specific video that she has, so this one got over 1,000 likes, and we can delve into it a little bit more on mobile, but it's harder for me to share the screen. So say like I look at this first video and it has 1 million views. We're just going to go for point of conversation so you guys can do this on your own time. If this had 1 million views, would it be viral?
Making us do math. Yes.
Well, yeah, good. So if she had like 250, it would still be viral. So that's 4 times her follower count, but you just have to do a little legwork in terms of what accounts you're going to. And if you're clicking around and seeing like this one got 9,000 likes, and the insights aren't as good on the feed here as they are on mobile, so you can actually do a lot more research. But I would just encourage you, when you're going to post something, just type it into Instagram and look at what reels are performing well, and look at their text on screen, and then play with it a little bit and see if it's relevant to your topic, and use AI. So use Claude and be like, hey, I have this B-roll. This is what I'm looking at. This video performed well. I want to tweak it a little bit so it's curated to my audience. And then maybe it'll come up with like A/B testing. Like Kelly had said, she hasn't tried that, but you could just do that in Claude and play with the hooks and trials, see which one performs well, and post it to your feed. And I just don't want to scare anyone, because I think sometimes people are like, I have to post the trials before I post to my feed. You don't have to. Sometimes I'll post a trial, and immediately after, before I look at the insights, I'll post to my feed. This is just for us to get a little bit more traction and kind of information, if you will, on our page. And what are the goals, right? If we're trying to get relatable content out, I think showing up on stories is super important. Posting to your page is super important. And even if you don't do 1 million trials, the algorithm will push your content if you post on trials and on your feed, not just trials. And I've tested this on my personal account just to see. If I don't post on my feed for a while on my main page and I just hammer trials, I do not get as many views on my page. So I want to encourage everyone to just post it. And I want to give everyone a little homework before we hop off today. So 5 specific things. I want you to pick a condition that you've treated this week, or maybe next week, depending on when you're watching this. Search a keyword on Instagram and see what people are watching. So we saw that video with plantar fasciitis. People want to see exercises. Okay. So food for thought from me. If I'm going to talk about that, I probably want to show some moves that I gave my patient that I discharged after 3 visits. Film B-roll or recreate an exercise that you think would be valuable. So if you have some B-roll already that you've treated, awesome. Write a hook around number 1, so the condition that you treated, and see what patients are asking about that. So you could even prompt Claude and be like, hey, what are patients specifically asking about this injury, or what are people Googling about XYZ, and write a hook around that. So like for this lady who's Googling her plantar fasciitis pain, and it's probably not even this, it's probably even more like, hey, my heel is hurting even more after a long day, and when I wake up in the morning, what should I do? Like, what questions are they asking that are going to make them want to watch? So, hey, did you have heel pain the first 5 steps this morning? Well, here's 3 exercises to help it get better, or something like that. Again, curate and tweak, but it doesn't have to be that hard. And then a clear call to action. So DM me X for if you want these 3 exercises sent to your inbox, or if you follow, you'll add more free PT advice to your feed that will save you thousands on copays. So it doesn't have to be that hard. I know this is a lot of information. We literally could delve into each of these for a half an hour and look at all the insights and all the things. But I just want you guys to start, because if we don't start, we don't have the data. And if we don't trial, see, then we won't know. So see how it goes. And I would encourage every single person either listening or on here today, post on your stories, show up on your stories. If you're doing your hair in the morning, post. If you're drinking your Stanley, post. Just show people who you are, because people want to resonate with people. They don't want a robotic curated thing. They want to see the real life. And I think that's hard sometimes, because we want to be like all makeuped up and look good and be ready to go. But you want to truly show who you are, not only as a clinician, but as a person. So I hope this was helpful today. And I want to open it up to you guys for questions. So what questions do you have for me?
Not a question, but I did notice that's a very popular account that you just pulled up. It's had, what,
Mm-hmm.
170 plus thousand followers.
Mm-hmm.
And
Mm-hmm.
those were all pictures of her doing the exercises, Amelia.
Mm-hmm.
Yeah, and so that's actually why I'm sorry, my face itched.
You're good.
That's actually why I started to go more into just doing videos of my exercises that I do anyways, because I actually
Mm-hmm.
do have a lot of injuries myself. So there's
Yeah.
specific things that I train and
Mm-hmm.
purposely do with the different exercises. And so
Yep.
I noticed that like my dry needling one got like 20 views. I'm just throwing out a really small
Yeah.
number, but like,
Mm-hmm.
and then one of my scapular exercises got like 800 views, and I only have like 100 followers. So I
There you go.
I noticed that trend really quickly, so that's why I switched into that, especially
Mm-hmm.
since all of my patients were like, no social media, please. And
Yeah.
then it's funny that you say recruit people. I can recruit my brother.
Mm-hmm.
I can recruit my parents. I don't see them that often, but my boyfriend is a part of the 7% of the population that has a full systemic response to dry needles and passes
I
out.
remember that.
So
I remember that.
I can't use him.
Make him do exercises. I want to see it.
Yeah, just manual or exercises or even
Yeah.
assessment.
Mm-hmm. And I think too, like if you go to my personal feed, like it's me explaining a lot of exercises too. And I feel like that's where we've gone to, or even like our concierge account, like Kelly and I walking, like certain B-roll that's not even relevant. And I want to shed light on that. It doesn't always have to be that both match up. It might be like a random B-roll with this
Yeah.
text on screen, and that's okay. Like literally Kelly and I walking, talking about cash pay, like we're not treating patients, but like it's captivating. What are they doing? So that's a visual hook. So I just want to kind of encourage everyone to think outside the box. It isn't just like XYZ. You can really be super creative with it. And that's where it's going. Like people want to see weird stuff, like random things.
Yeah.
Mhm.
The more random, the better.
Yeah, I
Well,
would agree.
thank you so much, Shania. So we'll have another sales call in 2 weeks. And I don't know if y'all noticed, but we changed them to be consistent. So it's 1 p.m. Central Time. We'll have either a coaching or a sales call, 4 weeks. So 4 Wednesdays out of every month. So you can catch this now on YouTube. You can also catch it on our podcast called No
Mhm.
Referral Needed. I don't know if y'all saw that yet. But these will all be put up there so that you can interact with them, learn from them. And just like you said before, you can comment more to get more information from us, but you can also follow along for more cash pay tips and practices. So thank
I
you.
love it. And I just want to give a shout out to my coach too, because I've learned a lot of these insights from Meg Brady House. So she is a powerhouse on social media, has over, millions of views per month. So that would be a good resource if you're looking for someone who's got curated content to learn from as well.
Yeah, thank you.